I want to talk about the cold chain. So the cold chain is a really important concept to understand when thinking about how people get vaccinated. A cold chain basically means that when a vaccine is produced, it needs to be kept at a very certain temperature in order to maintain its efficacy. It's no good giving a vaccination to somebody when the vaccine has become too warm because it just doesn't work. So most vaccines, for example the flu vaccine, are kept at low fridge temperatures. So when the vaccine is produced, it gets put inside refrigerated lorries and shipped around the country by the manufacturers. When it arrives in general practice, they arrive in polystyrene boxes, and that temperature is checked, and then the vaccine is then placed immediately in a fridge. Vaccines are only taken out for a couple of minutes before they are used on people. And the NHS and all health services across the world are used to this. We've been doing this for donkey's years. And in my general practice, we have fridges all over the place. We have 2 enormous vaccination fridges that are monitored and kept at just the right temperature, and smaller ones in the clinical rooms as well. Now, the COVID vaccination, certainly the one that's being used at the moment, the Pfizer-BioNTech vaccination, poses a bit of a different problem. This vaccine needs to be transported at minus 70 degrees. This vaccine soon loses its protective value if it becomes too warm. So once the vaccine is thawed from minus 70 to a temperature that's then comfortable to give to a human being, the vaccine needs to be used within a couple of days. Now this poses a bit of a problem when you're trying to organise a national vaccination programme. Unlike flu vaccines, which are delivered directly to general practices, this cold chain means there needs to be very specialist equipment in every single site where the vaccine is being given. This means across Thameside and Glossop, you are not going to see general practices holding immunisation clinics as we have done for the flu vaccination. Instead, there are going to be large sites, probably 4 or 5 across Thameside, where patients can book or be invited to attend. As our local programme rolls out, I'll be able to tell you exactly where these sites are. This is all done to ensure the vaccine is safe and effective. Until then, however, we still need to continue social distance measures. We still need to wash our hands frequently, wear masks out in crowded public places, and socially distance from other people and remain in our bubbles. If we all work together with patience and understanding, we will eventually beat this virus.